Thank you for traveling us here. We pray to commit our facilitators, our executives here in your hands to deliberate or give us more knowledge on stock civilian. At the end of the day, we shall give thanks and praise to you. Alhamdulillah, Rabbil Alamin, Ar-Rahman مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين
and the Challenge Facility for Civil Society project under Stop TV Partnership Ghana. So the purpose of this activity or workshop, which is going to be very lively, interactive and informative one, is to get you equipped, or as the name suggests, your capacity built for you to be able to do what you have been tasked with or what you have been tasked to do. So that is what we are going to do in this workshop today.
At the end of the day, the business of the Stop Partnership is advocate. We want to advocate for the resignation of TV from Ghana. That is what is there. We want to eliminate TV from Ghana. And so we will get ourselves involved before policy formulation. We are interested in putting TV on the political agenda. So I want to meet Baumia and talk to Baumia so that he will add it to his agenda when it becomes president. Okay. I mean, I say Baumia, the presidential candidate of MVP. That's right. Because now we don't have a presidential candidate. So assuming whoever wins, we want to meet that person. We want to, Mama is already decided when he's, we want to meet your Mama and see how he can add TV to his manifesto. So now we have a lot of discussions around parliament and all of that, trying to let big men understand that TV is a business and they need to do what? Complement the efforts, and then we build resources. This all is about getting money to make sure what we need to get TV eradicated, we have it. I'll tell you more in the process. But today, why are we here? It is because it is important for us to see. We have what we call the last one. I said to strengthen capacity of NGOs to find the missing pieces. But we want to decentralize the structure of Stop TV Partnership. So as we have a national board at the national level, we have been taking on meeting the president, we are taking on meeting parliament, we are taking on meeting ministers. We have the regional committee. You are also interested in meeting the regional minister, the regional director of health, the regional of education, the regional this, the regional that, the regional this, the regional that. So that whatever is happening at the national level is happening at the regional level. And then we're hoping that we are going to form the district committees. So as you are engaging the regional minister, the regional director, and so on and so forth, at the district level, they are engaging the district representative, engaging the health director, engaging whoever manifested. We are fostering partnership. For what reason? That reason we explain why we are here. That is why we are here. So these committees are meant to be a representation of the Stop TV Partnership for the purpose of achieving our goal, our vision of a TV-free Ghana. I am happy to say that, be happy that you find yourself in this committee, because it is going to expose you to a lot of things, it's going to strengthen you, it's going to make you do things you have been doing already better, and for those who have never been part of doing those things, you will not learn to do it, and then I bet you are going to enjoy it. You are welcome to this meeting. Thank you. I'm done.
So the Challenge Facility for Civil Society, what are you? Everybody has seen you.
I know.
Okay, please introduce yourself. From which region? Northen. Okay, thank you so much. Let's clap for you. Okay, yes, for coming late. Alright, so the Challenge Facility for Civil Society for 11 projects is Let me first of all say that this is an initiative by Stop TB Partnership. Stop TB Partnership, I didn't have Ghana. Stop TB Partnership is a global organization that is dedicated to the eradication of TB at a global level. That is Stop TB Partnership. This project is coming from Stop TB Partnership. So let me go ahead and explain the background. So the background of Challenge Facilities for Civil Society is that as part of the End TB strategy by WHO, addressing human rights issues around tuberculosis is very important. So what that means is that in the journey of ending tuberculosis by 2030, part of that journey is addressing human rights issues, stigma and discrimination issues, barriers to healthcare service. All these things need to be addressed if we really want to achieve the global target of ending TB by 2030. Is it clear so far? So the Challenge Facility for Civil Society is the Stop TB Partnership grant mechanism for TB affected community and civil society grassroots organizations to transform the TB response so that it promotes and protects human rights and gender equality. Strengthening community and civil society responses is an ethical and programmatic imperative in this pursuit. So that is what the Civil Society, Challenge Facility for Civil Society project has come to do. The key words here are protection of human rights of persons living with and affected by TB, taking away stigma and discrimination, and then removing barriers to healthcare services. These are the key words for this project. That is what you are going to do as regional advocacy committee members. So these are the objectives for the CSCS 2011 project under Stop TB Partnership Ghana. So the first one we have is to establish sustainable TB advocacy committees at the regional and district levels by March 2024. So you can relate with this one better, right? Because this is part of achieving that objective is why we are here. Good. Objective number 2, to build the capacity of 112 regional and 200 district committee members to promote community-led, right-based, gender-transformative and accountable TB response in Ghana by March 2024. So the capacity building that objective 2 is talking about is also the reason why we are here today. 27 is that we need representative from Ghana Health Service, which will be done later on. We also need representation from either private sector or academia. The 2 added to the 5 who are already here, making 7. So the 7 by the 16 is the 112. And then the 200 district committee members. Now that will be the next step after we are done with the regional one. So, and then objective number 3. The reason you keep seeing by March 2024 is that is the time that the project is supposed to come to an end. But we are hoping that we can keep the committees active even after the project has ended. And also, Stop TB Partnership Ghana has won the round 12. So it means that there will be another one continuing after this one ends. So objective number 3, to undertake quarterly advocacy and monitoring activities using community-led monitoring tools by March 2024. Now this is what the regional advocacy committee members and the district committee members are going to be doing. Because if you don't monitor, you will not see the issues at the ground level, and hence you cannot resolve them. That project activity, sorry. The first one is to have an inception meeting with NTB staff, which we have done. You know, NTB is the major player of TB here in Ghana. So if it comes to TB, you can't really do anything without them. So we had that meeting, and we also did a needs assessment with the help of a technical assistant. Now, what the needs assessment did was to help us understand what are the prevailing issues surrounding TB in our communities. Because if we know what these prevailing issues are, we know where to focus our energies. Do you agree with me? So we had a technical assistant supporting us. I think those of you who are on our platform, we sent a Google survey and we asked you to fill it. We asked you to forward it to your regional health directory, district health directory staff, and all that was to get the information we need so we can understand where the prevailing issues are and then focus our energies there. So that has also been done. And then we have the stakeholder meeting and project launch. Now, that was to get all our stakeholders on board. You know, if you study project management, they'll teach you that stakeholder involvement is key to the success of any project. So we assembled our stakeholders in a meeting like this. We validated the needs assessment, the input into project activities and all that, and then we closed it and moved forward like that. Established 60 regional advocacy committees, of course, that has been done, right? Established 20 district level community TB advocacy and monitoring committees across the 60 regions of Ghana where our IPs operate with the Global Fund. So that is the next step from here. So now, part of the job of the committee is to let the regional directorate know this is what we are going to do, and then we need the regional health director himself, ideally, to be on the committee. Now, if he says yes, fantastic, right? But if he says, oh, let me give you someone else, that's also fine. So that is what we want to do now. So we are going to be working with Dr. Dusipo. So we are going to be working through him to DG and then Director of Public Health, and then they will now write to the regional directors that expect a team who will be coming to you on this and that. So it will make it easier for you to
Let me just analyze this one. We went to a morning trip, and this gentleman was left alone in a particular community. So we entered the house, and the family members don't even want to go closer to this gentleman. So I tried finding out what is the problem. In the local language, we were told from the hospital not to get closer, otherwise we ourselves will be affected. So you see what I'm coming from. So from how the communication from the hospital to the family members.
That was the problem.
You get the name. Exactly.
Okay.
It's about getting this community to take responsible to remove the barriers. Sarah, to all the problems that you are raising now, at the end of the day, that is what the community is supposed to achieve in the lives of people living with TB. So if there is a community responsible, and there is this committee made up of somebody that has treated TB before, somebody that is from the regional health directorate, and then you have 4 civil society people being responsible to ensure if there is a barrier, we will move it. We expect it to move. By the time we are done, we'll stop the talks in a very short period, and I believe everybody will just understand it. Our Holy Ghost. So that is the thing that are swimming up in you. Is the reason we are forming the committee. So that you can go ahead and trust them.
Okay. When the patient develops drug-resistant TB. So the drug-resistant TB means that the patient there's one particular medication that is not working for that patient, and then it can graduate to multi-drug-resistant TB. What that means is that if we take rifampicin, isoniazid, and all the medication for TB that we know for drug-resistant TB, if we administer it to you, it will not work. That is when you miss your medication. That is when you develop multi-drug resistant TB. Now we've learned that there is even extra multi-drug resistant TB, and there is even extra multi-drug resistant TB. And these are all things that develop when you don't stick to your medication intake as you have been instructed to. Is it clear so far? So it is very, very important that every patient takes their medication as they have been instructed to every day. Now, WHO usually, formally, for multi-drug resistant TB, they give you a special combination of the medication that can cure you, and that takes 9 months. But WHO, through their research and everything, they've been able to develop the new medication, which is deeper. That one has shortened the time period to 6 months now. So that is the new update in terms of the medication that we have. So yes, Mr. Hunter.
Well, I mean that one is now going to be rolled out.
Yes.
So if somebody is still be multi-drug resistant diagnosed today, that person may not have the 6 months regimen, because the rollout is now coming to start. The rollout to start means that all the health people who treat TB at the various hospitals have been trained to understand. The information goes from the Director General to them, and the drugs are made available. So yes, there is policy adjustment agreed, but the drugs must be available for you to implement that regimen. I hope someone is getting it. Number 2 reason is that there is already the 9-month drugs, and there are a lot of people who are on that drugs already. So the government is managing the stock. So the 9-month stock must also finish, and then the new ones take over. Are you getting the management? So that you go to your region and say, oh, it is now 6 months, and yet they put somebody on 9 months. Then it becomes like we deceived with that. All these things are processes. I hope that makes sense.
Yeah. Thank you. Yeah. So I'm talking about medication. I don't know whether partnership have received complaints of the side effect of the medication.
Yes, I think
These are some of the things in my area. You observe people becoming resistant because one takes it 2-3 times. The side effect puts the person off. So it takes a lot of counseling and a lot of encouragement to continue. And what I'm saying is that with the research that academia is doing, can we also voice out some of these concerns for us to look at the side effect, how it can be minimized, to encourage, when I say patients to take it, because some of these are some of the complaints we get.
yes. Before I get to you, we understand that the medication requires good nutrition. The patient needs to eat and eat well. Now, here is the problem that even some of the patients are unable to afford a simple 3-square meal to be able to take it. So now, that's the problem that we have. Previously, there used to be the measureless package for all TB patients, right? But unfortunately, one way or the other, Global Fund put an end to that. Now, what is available is a measureless package for only MDR patients. So there's that support for the patient to be able to afford good nutrition.
What do you see the applications?
Okay.
So, multi-drug resistant TB patients. So the measureless package is now available for multi-drug resistant TB patients. So that one is there. Now for the other ones, who for one issue or the other, they don't have the measureless package, it now becomes a problem. For some of the NGOs, they take it upon themselves to ensure that the person is eating well.
So what is your concept? You see, don't say it. I understand your concept. How can we ensure that this issue is addressed? That ensure the concept is strong, so that you don't kill yourself explaining for much. There is no money to give anybody who is on treatment for normal TB. It's sure. And But this committee now, how can we ensure that that person doesn't die? And even after he has been diagnosed and placed on treatment, how can this committee make sure there is enough food for that patient to eat for the period of the drug for him to recover?
So let's hear from you.
Are you getting
Chairman, let's hear.
So as an NGO, what can you do? As a health director, what can you do? As a committee, who and who can you contact in your district or in your region? You know there is a budget in the district assembly common fund, 1% or sometimes more for the purpose of HIV.
Yes.
Is that right?
Yes.
Hello. Are you getting it?
Sure.
How can a committee, health director, can we speak to the district executive? See, this is why this committee cannot go and sleep. You have to know everybody. You need to. So I hope the answer to your question is.
My challenge is that the common fund sometimes pays 3 or 30 every time.
Okay, we are looking at extreme cases. I get it down. We are looking at extreme cases. At the end of the day, how can you solve that urgent problem? Sure. You understand? How can you solve this problem? That is when innovation comes. That's how saving lives.
You guys speak to the family and you convince them to.
Yes, the first point is the families. How can we make sure the family understands the consequences of what they are doing too? How can we make sure they understand the disease and know that, look, after 2 weeks, this thing is so terrible? No. Understanding the disease itself is very important. It's the key thing. All of us here have the TB bacteria in us. All of us. It only begins to come up when your immune system is so down. So that person in that family only had an issue with his immune system. That is why he escaped up. So all of you in this family, you can also become TB tomorrow. The fact that he is now is not the reason you will be TB.
Okay.
But what it means is all of you have been exposed to TB somehow, anyhow. Either through a transport you joined or this workshop you have come now. If anybody is, the TB is up and is coughing now, you will hear it. It is on. It doesn't mean tomorrow morning you will become TB patient. It will take a long time before that bacteria, depending on your lifestyle. Maybe you are a smoker, you are a heavy drinker, or any other thing also there. Now, the families of people who are positive, who are on treatment, can be given what we call what? The TB. The TB preventive therapy. So if you are in a community, you have this information, this understanding. The health director is so, what I'm hearing from you is deadly. I mean, the health directors, the district health management team should have known that. Look, in order to prevent you from even getting whatever, we are giving you this medication. So as he takes his medication, you to take this one. It's all supposed to prevent all of you. So you can take care of your patient. You don't need to take him away from your house. He can sleep alone in his room. Observe him and make sure that he eats well. It doesn't mean that you cannot walk to him. Are the people not, it's this sputum that is diagnosed, not taken to the lab? Sure. Is it not a human being that work on it to detect it? They are always in the lab trying to. But they are actually holding the thing that is contained, that contains the disease. How you are getting? So human beings are dealing with all this, and they are not dying. All we need to know is that this is curable. And whoever is on treatment within 14 days, you can't even infest anybody. You are not cured. You cannot infest anybody. You need 6 months full for the cure to be complete. How can that make sense?
It's partnership. Maybe we may get this as we go forward, but I want to see how partnership will actually strengthen. I saw it when you mentioned
actually strengthen these communities so that we can actually work and work harder than some of the committees, you know. The committee is set up at the end of the day, they will even present their report and that ends it. It is never implemented. What hours do we have to actually pursue these issues so that we're able to get some of these issues being resolved even at the district level, not even coming to the regional or even national level. So that's our argument. Okay.
You want to put the powers in?
Yes, I want to.
There are no powers in. What we have is passion.
Passion.
What we have is passion.
Okay.
You see, you know how we brought this money to come into this room? It is not power, it's passion.
Okay.
It makes sense to you?
Sure.
It's passion, right? What I need from you is passion. And that is driven by your organizational goals. Why is it that we brought you? It's because you have the passion to run an NGO, you have registered an NGO, you have a legal status. You can be sued, your organization can be sued, and your organization can also sue. We are working within that framework. Is that it? Okay.
For control and prevention, for those who are the key population in the TB, HIV, alcoholics, smokers, minors, and all those people, we give them what we call TB preventive therapy. Now, this is medication that will stop the infection from invading the system if it is introduced into the system. So that's what the TB preventive therapy does. So for persons who live with an infected person, their work partners, their family members, and all those people, they form the key population. They are giving the TBT to prevent it. Now, on your own, you should eat well, you should exercise, you should take care of your body, and your immune system will be strong enough to keep the bacilli at bay. And always ensure that you are in a well-ventilated environment. So as we are sitting here, the door should have been open, the window should have been open. So Chairman will say, if you are in an we are not doing the right thing. So always ensure you are in a well-ventilated area, and you are sure of keeping prevention. Thank you so much. That's it for the overview on TB. Madam Augusta Baden is a staff of Stop TB Partnership. That's in Geneva, Switzerland. But she's in Ghana at the moment. She just couldn't be here, both physically and virtually today. But she has empowered us to be able to give this presentation. So this is the format or the form that the presentation is going to take. Why community rights and gender in TB? We need to understand the why, first of all. What global institutions are saying about the need for CRG to end TB, that's community rights and gender. What communities have to say about the need for CRG to end TB, and then the last, what Stop TB is doing to support CRG to end TB. So this is the outline that the presentation is going to take. Every year, health systems miss millions of people affected by TB, primarily key and vulnerable populations because of barriers to health services, human rights violations, stigma, and a lack of access to support services. So when I was starting with my first presentation, I said that in the journey towards ending TB by 2030, addressing community rights and gender issues forms part of that journey. So just as it is stated in the presentation, every year, especially here in Ghana, some people don't even go to the facility or refuse to be diagnosed of the disease because of the fear of the stigmatization that it comes with. Is it clear so far? They are seeing what people infected by TB are going through. They just don't want to go through it. So if they are coughing, cry, they'll just say, oh, it's just a small cough, to go away. They even don't want to be tested in the first place because they don't want to be associated with TB. And that is a barrier that we need to address. Those considered the key and vulnerable populations are so considered because of increased exposure due to where they live or work. That's in bracket urban, poor, minors, garment workers, limited access, that women and girls, transgender populations, mobile populations, rural poor, and increased risk due to biological factors. People living with HIV, alcohol. So that point is just explaining defining the key and the vulnerable populations which I mentioned earlier. So it's just those who are at an increased risk of being infected. So if you are a regular consumer of alcohol, you are a smoker, you work in a mining community, you are HIV positive. Now all these conditions make you someone who is at a higher risk of infection. So that's what we refer to as the key, the vulnerable populations. As a result, millions of people year in, year out are not realizing their right to health, and as such, governments are not fulfilling their obligations. So a lot of these people don't even know that they have some rights or human rights entitled to them to even begin with. So if they don't know it, they cannot enforce it, they cannot call for it, and as a result of that, the governments are not fulfilling their obligations of enforcing the rights of these people. So what is the community rights and gender approach? The approach is to reach the missing millions. If we really want to end TB by 2030, and we are in 2023, which is ending now, we are ending 2021, so give or take, we have about 6-7 years to go. If we really want to end TB by 2030, we cannot turn a blind eye to these marginalized people who are not being diagnosed on a yearly basis. It is for action against poverty, for social protection, justice, and health. So that's what I was saying, that the community engagement is unique from community to community. The team can be made up of private sector, the government, the health sector, the local chiefs, the assemblymen. If all these people can come together for this common goal of addressing issues of poverty, social justice, and health surrounding TB, there is a very good chance that they can solve that problem. So I was saying this instance about a business, right? If the team can come together and approach one company in the districts, it might be a mining company, it might be a production company or something, and say, look, this is the problem we have in this community. And it is in this same community that you are doing your business and making your money. So why not just be nice to all of us? We have X number of people who are dying because they don't have food to eat. Or we don't even have a gene expert machine in this community. We don't have the materials we need to do the screening or why don't you support us? You can buy a gene expert from laboratory and bring it so that we use it. And then we'll tell people about the good things that you are doing for our community. That will even help your business to even sell more. This is a community approach that they are using to address the issue. People with TB and communities have the right to participation, and so should be partners in designing and planning TB strategies and interventions, implementing interventions, and play a key role in monitoring and evaluation. So the people that you are doing the thing for, why not include them in the development of the solution? Because they know what they need. Someone might say, okay, my problem is that going to the hospital for my medication is very, very difficult. Because the place is far, I don't have a car, I don't have a bike, I don't have money to go. So let me just stay home and relax. Right? So if the person is telling you that this is my problem, and 2-3 other patients are saying, yes, I share in that one, why not include them so that your solution is such that it solves the problem that they are facing?
Now, so here we go. You see, Emmanuel is discussing rights, communities, rights, and gender. It goes with rights go with responsibility. Every TB patient has right to medication, right to treatment support, right to nutrition, right to everything. they also have responsibility to be ready to bring the medication. Because their responsibility, if they refuse to do it, will also affect somebody's rights.
Yeah.
Because if you are my wife and you refuse to take the TB drug, it means you have decided to infest all of us and make all of us sick. So even as we have the responsibility to support you to make sure that you take the drug, you also have the responsibility to swallow the drug and swallow it according to the plan, in order to save all of us who must support you. Is it making sense? So when you enter a community to do education, especially when you get to the space where you need to talk about sputum collection, sputum transportation, bringing of results, the people must know you have a right. We are saying gender rights, communities. We are saying let us be free in our heart to allow everybody to enjoy their services. It's simple. If you discriminate against one, tomorrow you will know when it hits you in your family. So we want to make sure everybody is enjoying their right. Is that not it? All we are saying is that there are global commitment. Global commitment means that at the highest level of the world, there are commitments on these things. These things were really strong coalition with civil society. See, globally, Global Fund is ensuring that civil society are involved in everything we are doing. Everybody, WHO, all those big multilateral, Bill Gates, mentioning them at the global level, all of them have agreed that civil society must be part. Community, this is why we are doing this. We are bringing civil society, we are bringing government, we are bringing people who have treated the TB. It is bring civil society. And they are committed to protection and promotion of human rights. Take it or leave it. Me and you have to protect human rights. Allow everybody to go ethical, do the right thing for God. That you are a Christian, so when a Muslim dresses in her apparel and mayafi and come, you because you know Jesus, so people do not take wrong. My friend, shut up. Nobody should discriminate. The world has settled on these things. You can't do otherwise. Go and protect people so you can also be protected. When people are discussing gayism and it is not for you to promote gay, but it is for you to speak professionally. These people deserve also to be treated for diseases they contract. Just as the pastor who is HIV also deserves to be treated. Just as the Muslim man or the Christian man deserves. Everybody deserves or has a right to treatment, has a right to. This is why the mosque imam, is it imam? Sheikh, what's the name? Prayer or mosque is what? Imam. This is why chief imam or imams allow communities to come and educate people in the mosque. Am I right? They will talk about malaria, talk about HIV to their people. In the church, pastors allow people to come and educate their members on these things. So there is patient care center. I mean, everything should be patient centered. Everything you are thinking is a patient. It's not a commercial sex work. I say patient. Forget about the work he does. Community people-centered approaches, human rights, gender-based approaches, promote and protect human rights and gender equality. I guess all this has been explained well here. Yeah. All presidents of nations have agreed to that, including that of Nanado. This is the power I will be strong. Hamza is asking me what power do you have? I want to show you the power. It's a document that when we went to New York, we called on all presidents, the whole world, to adopt a declaration, which is commitment to TB. That document has been shared with you who are members of the partnership. Those who are not yet, it will be shared again with you by the executive secretary. This document, this document has commitment on all these things you are reading. MTB, stigma and discrimination, access to medication, overcoming legal barriers, gender equity, participation of TVP people and vulnerable population, and equitable and human rights-based approach. Say, listen to me. The United Nations General Assembly has adopted commitments, which include what we are doing here. It includes stigma. You see, that person whose parents, whose family doesn't want them to, the world has declared that we must make sure that discrimination ends. And so this responsibility you have to help us to end it. You are the representative of the president. The president has committed to that for all of us. This is the power you have. Hello. Work if we are going to succeed. One convince you will be our idea. You can convince somebody to really take their job. You thank him. Thank the nurse. Thank the district executive. Thank everybody listening. Be always thankful to people. That is the biggest problem we have. Look, some people, I have one or two people who call me as chairman of Stock Partners. They always call me, Chairman, I just want to say thank you. You are very able to progress. And there are some, the only time they call is when they need something.
This is a central platform or central digital technological platform that supports the CRG work of Stop TB. And it is a key community-led monitoring tool that you as regional advocacy committee members are going to use in your work. So by the time you are now installing and going through the app, you will understand how it works and what you are supposed to be doing it for, doing with it. So the name of the app is One Impact, and the slogan, if you like, is empowering communities to end TB. So everybody please take out your phones. If you have an Android device, please go to Play Store and search for TB Impact GH. No, it's an app. So you go to Play Store.
It's in internet.
Internet. You have it. It's just a few megabytes. You go to Play Store and search for TB Impact GH. So what this tab of the app does is to inform anybody who is interested about the rights of persons living with or affected by tuberculosis. Now, I will share a document later with everybody that has all the details. It's a full PDF document developed by Stop TB Partnership. But you can also get that information here on this tab of the app. So when you open that tab, you will see rights of people affected by TB, state obligations under international and regional human rights law, non-state actor responsibilities under international and regional human rights law, and then the last one is Ghana's Constitution of 1992, Chapter 5. So all these things are just informing you of the rights of persons, of the TB people. Let me put it that way, it's clearer. Because if you are a TB advocate, you need to know what their rights are. If you don't know what their rights are, you cannot advocate for them. Do we all agree? Yeah. So that is what the first app does. So let's go back to the home page and open the second tab, which is Get Information. On the international platform, as and when they come, will be updated, and then you have access to it in this tab of the app. Is it clear so far?
Yes.
Okay, so that is what the Get Information tab does. So at the top of the page of this tab, you will see medical experts, and then there's people affected by TB. So over there, so you will get more information about people affected by TB, TB survivors, TB patients, and all that. People sharing their stories. success stories or stuff like that. Is it clear so far?
Yeah.
Okay. So let's go back to the home page. Let's go back to the home page and then tap on Get Connected, which is the third one, the third tab. So when you click on Get Connected, you should be seeing this. So let's all click on TB Impact GH Advocates. Just click on it. So what this function is just information sharing and communication, just like on a social media platform, right? Yeah. So you see report and issue. That's the first option at the top. Under report and issue, we have barriers to TB health services, barriers to TB support services, human rights violations, and then TB stigma. So if as an advocate or as a TB person, you have been discriminated against, your rights have been abused or anything of the sort, once you know what that particular issue is, then you know which of the tabs to select. So for example, if I'm a TB advocate and I have witnessed a healthcare provider abusing the rights of a TB client, I will go to barriers to healthcare services. So when you enter that particular form, right, the app will now ask you detailed questions which will form the report that you want to file. So for example, I am under barrier to healthcare service. I have the first question being TB services are not available. I cannot access TB services. The TB services at my health center are not acceptable. The quantity of my TB services, the quality of my TB services is not good. You need to ensure that the work that your NGOs are doing, there's accountability, there's transparency between your NGO and your district, and between your NGO and the region. So we shouldn't come to Upper East and mention Mr. Amogba and say, who is that? See, at the beginning I was saying that the formation of this committee will cure the sickness of we don't know them. I will not sign the endorsement form. Is it clear? Sure. Conduct field visits to every districts and communities to glean first-hand information. Deal with all unresolved matters at the district level to the regional committee. So if there is any unresolved issue between the district and the NGO, yes, what you're saying is true. Yeah. It is the responsibility of the regional advocacy committee to ensure that that matter is resolved. So if there's an NGO in your region that has a problem with their district, you have to intervene as regional advocacy committee members. The responsibilities of the regional committees continue. Compile reports on all meetings, findings from field visits, and other relevant reports. So all your quarterly meetings, you have to report on it. All your monitoring activities, you have to report on them. Contribute feedback that will feed into the discussions of the Stop TB Partnership at the national level. So when we are at the national level and we are making so much noise, it is because we have a team at the ground level who is giving us real-time information from the committee. It is envisaged that the committee shall culminate in the following outcomes. 1. Provide a platform for service providers and key stakeholders to interact and share ideas as well as address bottlenecks in service delivery. So, you as the regional advocacy committee, you are an opportunity for the service providers and the key stakeholders to come to a common ground. On the committee, we have regional. They are the service providers, two of us.
Yeah.
On the committee, we have the CSOs. They are the ones who are part of those who are pushing for the service delivery, true of course. So that is a platform where the health providers and the key stakeholders meet. I think it's clear. Is it? Yeah. So this is the outline that the presentation is taking. We have the background, the TB advocacy admin. Are we not tired? Background, the TB advocacy committees at the regional level, global and goal and objectives, routine activities, composition of the regional advocacy committee, duties and responsibilities of the regional advocacy committee, and then expected outcomes. Okay. So background to the formation of the committee. Ghana operates an integrated decentralized health service, especially at the district, sub-district, and community levels. So we all know that we have the regional level health facilities, right? Like the Northen Regional Hospital. Now when we come down, we have the district hospitals, right? And then when we come down to the lowest level, we have the CHIPS compounds. That's the lowest level of the health facility. So they are able to decentralize service delivery to the populace at all these levels. So it's in the same vein that we have also formed this regional advocacy committee, because at the national level, we have an advocacy team. Myself, Adams, Chairman, Anna, and other members of the partnership at the national level, we have an advocacy team. So we have meetings with the government agencies. We formed the TV caucus in Parliament. We've done. We actually wanted to be the first lady. I think that's one of the next things that we have to do. Now we have the national level advocacy committee, right, or team. Now, in order to make sure that our advocacy is really effective, we need to have another one at the regional level and also another one at the district level. That way, just like how Ghana Health Service has decentralized service delivery to the lowest level, we can also decentralize our advocacy efforts to the lowest level. So that is the thoughts that gave rise to the formation of the regional advocacy committee. So community-based services are provided through the community-based health planning and service. I've already mentioned that. So continuation of the background. For effective and close monitoring of the operations of various implementing partners working closely with these health systems, there is the need for a decentralized advocacy and monitoring systems. So we have a number of our NGOs working across the country, right? Now, if we have these regional advocacy committees in place, they can act as a check on the work that the NGO is doing in the regions.